Another common misconception that people have is that ADHD is not a real condition and we're just medicalizing bad behavior. My name is Jared. I'm a psychiatrist in private practice. I work at this clinic called Connections Mind Health. So ADHD stands for Attention Deficit Hyperactivity Disorders. It is a neurodevelopmental condition characterized by symptoms of inattention, hyperactivity, and impulsivity. So when we see a child with inattention, it could be a child who is not focused in class, not able to pay attention to what's being taught. An adult with inattentive symptoms could be someone who is always very distracted at work and cannot focus on the task at hand. With regards to symptoms of hyperactivity, a child with hyperactivity could always be running around the class, always on the go, climbing on the furniture, jumping off the furniture, whereas an adult with hyperactivity could always be fidgeting, shaking the leg, cannot sit at the desk, go to the toilet many times a day. There's also these other symptoms of impulsivity. A child with impulsivity may be very quick to speak, always answering questions in class, not wanting to put up his hand, whereas an adult with impulsivity may be always interrupting conversations, not letting you finish what you say. ADHD affects both males and females. For the boys that we see with ADHD, they tend to have more hyperactivity symptoms, whereas for the females that we see, they tend to be more inattentive. ADHD is quite a common condition. It affects about 1 in 20 children that we see, and it is a condition that accompanies people all the way from childhood till they become adults. There's certainly more people seeking help for assessment of ADHD. These include parents wanting their child to be assessed and also adults seeking a diagnosis. I think this can be attributable to many reasons. One, there's greater awareness, greater mental health literacy for people to recognize symptoms and more willingness to seek help. There is greater destigmatization of seeing a mental health professional, and this is because of a lot of the good work that's been done in Singapore. We also think that the conversation is being normalized because there are a lot of influencers or media personalities openly sharing about their own struggles with conditions like ADHD. I think this prompts people to be more willing to come forward to seek help. So even though there is greater awareness of ADHD, what ADHD is, and a greater willingness to seek help, when we see our patients, both children and adults, we do find that there is a lag time between the development of symptoms and them coming forward to seek help. A lot of times we hear stories of how they feel that they're just being lazy or they're just having very bad behavior, very naughty. Or sometimes parents tell us that, oh, my child is just going through a phase, when this phase is over, things will be better. But that's not true. I think a lot of times when we do an in-depth interview, interviewing both the child, the parents, the loved one, and sometimes we even go to the school to talk to the teachers, we find that this is a pervasive problem and the child has been having symptoms for some time. Sometimes when I speak to patients' partners, their spouse, they will say that they've been living with the person's condition for a long time. Another common misconception that people have is that ADHD is not a real condition and we're just medicalizing bad behavior. Well, ADHD is a neurodevelopmental disorder, and there are many studies, brain imaging studies, genetic studies, that also looks at the brain, that critical areas for executive function are affected. These are areas of the brain that controls impulses, controls attention and focus. So when we assess a patient for ADHD, whether they are children or adult, we don't just see the patient themselves and take a quick interview and decide whether this patient have ADHD or not. We also interview caregivers. We also interview significant others, including teachers if they are in school. Sometimes we subject them to neuropsychiatric testing as well to look at the areas of dysfunction that they could present with. And then we treat them with medication. So apart from using medications to treat ADHD, we need to recognize that medicine is not the solution. It is part of the solution. And this involves working not just with the child, with the family, also with the school. With the child, they can go through things like classroom skills training, classroom strategies, learning strategies. Sometimes children may need further assessment to see whether they have got a comorbid learning disorder that could have impaired their learning and not just the inattention. We work very closely with the schools to find out whether there's any issues with behaviors, with socialization, and sometimes we do know that some children would benefit from accommodations in school, like extra time, like having a prompter, or being able to take assignments and tests separately so that they're not distracted. This allows the child to actually fulfill their true potential, that they're not hampered by their symptoms. Finally, we work with parents. We do a lot of psycho-educational work. We want to tell them to correct some of the misconceptions that they may have about their child. We want to teach them parenting skills, like for example, the need to be consistent with regards to either rewarding the child or disciplining the child. We usually need both parents to be on board, or perhaps even other caregivers like grandparents. Other things that parents can go for would be support group. We know that parents can sometimes be very frustrated with the child's behavior, and it's important for them to learn not just from professionals, but also from other parents with kids with similar problems, to learn how they have managed their kids over time. So adults who suffer from ADHD, many of them have learned to manage with their condition. For example, using schedules, using timetables, but sometimes when the workload or when the stress in life is getting too much, they find that they can't manage. And that's why they would usually turn to seeing a doctor to get some help. And we do treat adults with medication as well. I believe in the early identification, diagnosis and management of ADHD because we know that ADHD as a condition, when it is left untreated, when it is severe, can lead to things like poor learning in school, can lead to things like isolation and poor socialization because they just have got bad behaviors and other kids don't want to associate with them. We do see that children with ADHD, sometimes they have a higher risk of developing depressive and anxiety disorders. So it is really quite important to diagnose them early and then give the right treatment. It doesn't necessarily have to be medications. A lot of times we can use psychological treatment, behavioral treatment to help them to manage their conditions. For the youth who are in school and you might be struggling with symptoms of ADHD or any other learning problems that you might be facing, do have a chat with your school counsellor. They'll be more than willing to help you. And if you think that any one of your friends, your family members may benefit from this video, please feel free to share it with them.